Hello, everyone. Thank you very much for your patience. We were waiting until 3:10, just so any students who finished class at 3 o'clock could get connected. Everyone should be able to hear who's joining in via Zoom. If you're having any problems, if you can just connect or put anything into chat, that would be great. I want to let everyone know who's here in the room and who's connecting online that this is being recorded. So that's perfect. Otherwise, questions will be watched in the chat, and we have people here in the room who can read those out. I would like to introduce Dr. Asif Chaudhry. He is the Vice President of International Programs here at WSU.
Thank you, Cody. Thank you all for joining us for this very important session where we're going to talk about the current situation with coronavirus and any other issues that might be on people's minds. And we were very fortunate to have with us a group of leaders and experts from the university who are going to be speaking to you and actually addressing some of those concerns. For international students who have called in or who are present in the room, let me just say a couple of things. As the Vice President of International Programs, looking after the welfare of our international student community and the student community in general is of paramount importance to me, as it is for the rest of the university leadership. So as any issue comes up where we find that there might be concerns on people's minds, we really do want to hear of those concerns. And if you have any questions which would help you lower the anxiety level as a result of the current situation that we are facing in the health arena, we would like to hear those questions as well. And that's why this leadership group that has come over today to speak with you and actually be in front of you to take your questions and actually talk about where we are overall with this situation and how is the university handling it. So instead of me continuing to talk about that, what I would like to do is first of all introduce to you our interim provost and Executive Vice President, Dr. Brian Slinker, who is going to come up and talk about the overview of where is the university in terms of dealing with the crisis that we are facing along with the rest of the world. Dr. Slinker.
So good afternoon, everyone. As Dr. Chaudhry said, I'm Brian Slinker. I'm the interim provost and executive vice president. For the purposes of this discussion and panel, I wanted to give you a bit of outline of the background of how the state of Washington is responding to the disease COVID-19. And some of the panelists here work with me on a group called the Executive Policy Group. So I wanted to explain what that is. The governor of the state of Washington, more than 1 week ago, declared a state of emergency so that we could mobilize the resources of the state's government to help respond to the disease. That stood up what is called an incident command system, where it's an emergency response system. And it's a structure that we implemented in all state agencies. So no matter what agency, and as a university, as a public university in the state of Washington, we are one of those state agencies. So you will meet later Bill Gardner, who's the incident command system head for WSU. So the president of the university is still the president of the university and ultimately responsible for all decisions. The president in the incident command structure is supported by an executive policy group. That executive policy group consists of 10 individuals from the leadership across WSU, including several of the people here today. That group meets twice a day currently, and more if we need to. We have standing meetings at 8 o'clock in the morning and 4 o'clock in the afternoon, 7 days a week. Those meetings go anywhere from 60 minutes to 2 hours twice a day. And that's because we have to plan how we respond as an institution to the information we have to help manage this disease. That the rest of the university normal leadership structure is still intact. I, as provost, still have a provost job to do to help manage the academic programs, the coursework, work with faculty development. Still have that normal job, but it's part of the executive policy group. I have a responsibility to recommend policy for the university during this time of response to the disease. And it's a group decision. We debate policies. But one thing I want you to know, it's happening all the time, and it's different than normal university decision-making. It's decision-making by a group, empowered to make those decisions and make them faster than the normal process. And some vice presidents, for example, are not in this group. It's a smaller group, so we seek input from all of the other leaders that are not part of the group, and we try to communicate, but it's specifically designed to be more nimble and respond more quickly. So what do we look at for guidance? We look at what we're allowed to do under state law. We look at what the governor of the state of Washington is telling us we must do. We look at what the federal government tells us we must do, and those recommendations may change. So we're always watching what the current requirements are. Right now, for example, the governor has said that state employees, so faculty of the university, staff of the university, may not travel to CDC level 3 designated countries. And that's been now extended to level 2 countries. There are 5 such countries right now. That number may change. We at the highest level, the president could potentially make an exception to that, but that's a government order that we must follow. And so those are the kinds of things we're working. Short of those kinds of orders, which there are not very many of them, we have to look for the public health agencies for best practices and guidance as to how to respond. The local health agency is the Whitman County Department of Health that reports to the Washington State Department. There's also a National Center for Disease Control, and then there's the International World Health Organization. All of those agencies issue guidance about best practices to respond. So we have, unless there's a specific rule imposed by government, we have to take that guidance coupled with the rules and other laws and come up with policies that best allow this institution to respond, balancing many interests. So that's the process. And again, we meet regularly and we make decisions about travel, about how we're going to, whether or not we're going to go to distance teaching. That's under active discussion. The decision hasn't been made, but it will be this group that makes that decision. It won't be the normal leadership of the university. Faculty will be consulted, but only very briefly. So this is a time of different decision making. So you need to understand that as well. So our decisions about travel, decisions about how classes are taught, decisions about whether student club meetings are canceled, decisions about whether university events are canceled. Right now, most of those are individual decisions left at a college level or a student club level under the general guidance. If the government changes its guidance, or if the government issues more regulations, then we will change our guidance in response. But those are the kinds of things we're addressing in a public health response, where the main responses are to be safe yourself, clean, hand sanitizers, don't touch your face, don't shake hands, those kinds of things. Socially distance, which is why we're thinking of canceling group meetings or going to teaching with distance techniques. A major response has to be reducing our interactions with each other, and that's beginning to happen. Some of it's self-selection, some of it will be by policy as we continue. So that's an overview, and the people here, as you learn who they are, from the Student Affairs, the Dean of Students, from the Center for, I don't remember what your center's called now, sorry. I always think of it as OEO, Office of Equal Opportunity, but it's been renamed. And the university's physician and also the incident commander, that we all have different roles, and that's why we're all here, so that we can talk to you about things that we're most knowledgeable about in our role. The other thing I will say was we want to hear what is on your mind. We want to hear what your questions are, the things you want to know more about, the things that concern you. And what I will tell you is we may not have an answer for your question right now, but we want to hear the question anyway. We really want to hear those questions because we want to know what's on your mind as we think about policy. We want to know how or where we might need to communicate more to address those kinds of questions when we do have better answers. So please, if we can't give you a specific answer, know that we want to know what's on your mind anyway, and we will incorporate that into our planning and future communications, knowing what's on your mind. So with that, I'll stop, and I'll just say that I'll probably sneak out about 4 o'clock. That's no reflection on you. I just have to get to another coronavirus meeting. So.
Thank you. I'm going to make just one comment, then introduce our panel leaders who are sitting here. And that comment is, I said that at the beginning, and Dr. Slinker repeated that in his own words, and that is, we want our international students to know that we as an institution are absolutely focused on one thing, and that is to provide everyone a safe, secure environment for learning, which is free of any harassment or biases. That's why the president, the provost, and I, subsequent to that, have sent out messages to all of the university community to let them know that that kind of behavior is not acceptable at Washington State University. And we would encourage students who might face that kind of discrimination in any setting, whether it's a lab setting or a classroom setting or anywhere else, to please let somebody know that something happened that made you uncomfortable. Because we want everyone, whether they're international students or domestic students, to be able to exist, study, and live in an environment which is free of that kind of harassment and situation. So with that, let me introduce the leaders who are sitting here. We have Bonnie DeVries, who is the Medical Director of Student Health Services. We have Bill Gardner, who is the Associate Vice President and the Executive Director of Public Safety of Washington State University. We have Holly Ashkenazad. Sorry, apologize. It happens with me all the time. Who's the director of that center that Dr. Slinker did not remember, and I remember the same thing as, but what we know is that she is the person that you would go to and talk to if you feel that there was any situation of discrimination, wrongdoing. She would help us navigate that environment. And then we have Jill Creighton, who is the Associate Vice President and Dean of Students. These are the leaders here who basically cover the gamut of various areas that would be responsible for dealing with issues that might come up or concerns that you might have. So with that, I'm going to request each one of them to come up and give us a brief overview of their respective areas, and then we open it up for questions so that people can ask specific questions that you might have. And I would encourage you that as you are hearing their comments, please be thinking of what are the things that would make you feel comfortable, what are the concerns that you might have, or the questions that you would like to hear the answers to. So, Bonnie?
Hello, again, my name is Dr. Bonnie DeVries. I'm a physician. I'm the medical director of Cougar Health Services, which is the department that provides healthcare and health services to students on the Pullman campus. And so my day job is to take care of students and give them everything they need, hopefully, to have the wellness they need to succeed academically. And so as part of that, me and other colleagues at Cougar Health have been doing a lot of public health emergency preparedness planning. And it came at a very good time. Just in the last 6 to 12 months, we updated and reevaluated the plan that we had, and in collaboration with multiple departments across campus, really took a look at where we were and how ready we were to face some sort of infectious disease outbreak or other public health emergency. And so it's very fortuitous that we had just done that work, because it's up to date and we were able to help departments get ready for this. And so lots of contingency planning is happening all across the Pullman campus specifically, and then the plan that we developed, we shared with all the other campuses, because how you respond to a public health emergency varies tremendously based upon your context, based upon the healthcare resources that you have and the severity of the health situation. And this is a fairly unique one in that it may impact all campuses. Most of the time when you have a public health emergency, it may only impact part of the state, and so it's important that that planning is contextualized. So I think for me, what's been very challenging about the COVID-19 situation is the newness of it. You know, had it been measles or mumps or something like that, meningitis, we know the science behind that. But this science has been changing moment by moment. I could tell you exactly what was on the CDC website before I left my office a half an hour ago, and it probably is slightly different now. So lots of information management as we try to make sure that we are being flexible and responsive to whatever the current recommendations are. And so, as have been mentioned by my colleagues, we're following the World Health Organization, the Center for Disease Control, the Washington Department of Health, and then for the Pullman campus, the Whitman County Public Health Office. And the farther down you go, the more specific you get, the more specific the recommendations are. And so most of the time they agree. Occasionally they don't, especially when the science is this new. And so we are, to sum that up, we are on a day-by-day basis reevaluating where we are in terms of testing recommendations and risk level and how we will handle the various things that come our way. And so lots of preparedness and lots of information management right now, as we still don't have a COVID-19 case in Whitman County. And so we aren't actually treating yet. We're preparing and we are managing information and making sure that we're up to date.
Good afternoon. My name is Bill Gardner. I'm with Public Safety at Washington State University. I'll give you a little bit of an overview of my role in the command structure of this response. My job is to facilitate the process whereby a set of leaders, a set of policy makers actually makes policy that then gets implemented by a set of operations people, and also facilitate the management of the emergency response or the incident command structure so that we can tie in our university with other incident command structures around the state and around the country so that we're all operating in the same way with the same kind of basic principles. But my day job is really in safety and security at the university. And I'm really glad that Dr. DeVries kind of characterized this COVID-19 issue as being so new. And she described a situation where if this was the mumps or the measles or whatever other things that we kind of know about, our response would be very different. Well, I want to draw a parallel to my experience in law enforcement. I started as a police officer 30 years ago, when my role really was to look at people breaking laws. It's pretty simple. It was a well-defined kind of a job. But as I have experienced in the last probably 5 or 10 years, especially on a university campus, it's not so much about enforcing laws and investigating crimes as it is worrying about how people treat each other. And that's in some ways a huge issue, and maybe a bigger issue than some of the law enforcement that really is in my background. And that's why I think I'm most interested in hearing about that today from you, because it is a difficult thing for us to get our heads wrapped around. There aren't a lot of laws about how we treat each other socially, and yet it's a huge concern for us. And so I was very interested when this opportunity came up to talk to you and to hear from you and to learn from you, because I think that we're in the same stage there as the medical community is in dealing with new viruses and COVID-19. We're trying to figure it out. We're trying to find good solutions for it. And we won't do that without hearing about it and learning about it. So please feel free to talk to us about that so that we can learn. The other thing I would like to say to people who are out in this audience who are feeling like they are being discriminated against, or they are feeling unsafe, or they're feeling threatened, is I want to make you a promise, and this is a tall promise, I realize, but I believe that it's a real one, and that is that the people who are for you and the people who have some understanding of your situation and value your presence here are greater in number than the people who are making you feel uncomfortable. Now, that's probably going to feel like a hard statement to accept when you're being discriminated against or you're being threatened, because you're just not going to feel that in your hearts. But I do want you to remember that I believe that that's true. There are a lot of people in this community who really value your presence here. They just aren't as visible at times when you're feeling like you're kind of under threat. And I'll leave you with that. And Holly.
Good afternoon, everybody. My name is Holly Ashkanajad. I'm the director of the Office of Civil Rights Compliance and Investigation. That's the name that everyone always forgets. We recently changed our name. You can remember us as CRCI. I've heard a lot of students refer to us as Cersei from Game of Thrones, if that's helpful. My office's role is really there as a resource for all students on this campus. I want to second what Bill Gardner just shared, that there's a lot of people here who support our international student community and our staff. We are seeing across the country different treatment, xenophobia, harassment towards international communities or people that they perceive as being from international communities. We want to hear about all of those concerns. Our office can accept complaints related to those. We all know that discrimination can happen really on a pretty vast spectrum, from maybe one passing comment to something very violent like a hate crime. We want to hear about everything you're experiencing it. So I just want to encourage everyone here, if you do have a concern, to report it to our office. We do have an online website, crci.wsu.edu. There's a file a complaint form there that's available in multiple languages. You don't have to even put your name in. If you just want to report some information, you can report anonymously to our office. We're happy to receive that information. We're using it as a university to determine what level of response the university needs to have for the experiences that our students or staff are experiencing. You can also come in and actually file a complaint directly with our office if you've experienced something that you'd like to see conduct processes on, sanctioning processes for staff members at the university. If you're experiencing something within our community, we also want to know about that. So I just want to extend a welcome to everybody, and please ask all of you to participate with our processes if you do experience anything, or if you want to report something on behalf of a friend. In the meantime, we do have a lot of information for students about other resources available to you as well. So if folks were interested in visiting our website, or they were unsure about reporting to our office, or were scared to report to us, we have other resources that are available to you both in the state and federally, as well as confidential reporting options. For folks in our different system communities, I do want people to be aware that in every county in the state of Washington, there is a crime victim advocacy center. If you experience any type of hate crime or anything along those lines and you want to talk to a confidential advocate, we have links to those folks on our website. A confidential advocate is somebody who is just trained to help you manage any kind of crime situation. They can help you go to the police, they can help you report to our office, they can help you seek a protection order, they can help you file paperwork with a court system. It's just somebody that's there to help on your behalf. They also have 24/7 crisis line services, so if you have experienced anything and you need to talk to somebody immediately, they are a really great resource. At the end of all this, I just want people to keep in mind too that if you're not comfortable reporting to our office here on campus and you don't have a crime that you want to report to victim advocacy or law enforcement, you have a huge community of people here who really care about you. So even if you're not at the position where you want to talk to somebody about what's happening, if there's a friend or a confidant or a support person or an employee on campus that you feel comfortable speaking with, I encourage you to do so. People are routing information back to our office so we can have a picture of what our community is experiencing, and we'd like to continue that. Thank you, everyone.
Good afternoon, everyone. How's it going? Excellent. My name is Jill Creighton. I use she, hers pronouns, and I'm your Associate Vice President of Student Affairs and Dean of Students. And a special hello to everyone who's out there in Zoom land. I hear we have quite a number of you who've joined digitally, so just want to make sure that we know that you're here. I also want to give a special thanks to our President of International Programs Club for taking questions over WeChat. So I know that there's a lot of information that's coming in, and you have a lot of things that you want to ask. I want to start by sharing that my job as your Dean of Students is to care about you and to care about your well-being and to care about what happens on this campus. So I'm going to do my best to work with each one of you individually when you have individualized concerns, and also to help answer some of those larger questions about what's happening at the university. I oversee housing and residence life, which includes all of our residence halls on campus, as well as all of our apartments. So if you have friends or colleagues or peers who live in, for example, our graduate student apartments or our family apartments, those are areas that we have. I want to ensure you that we are keeping our residence halls open over spring break. That's a tradition that we've had for many years. So if you are staying for spring break, please make sure you fill out that Qualtrics form that was sent to you by your RAs and your hall staff to make sure you let us know that you're staying. That will help us understand how much food to buy to keep in the community. We can't feed all of you if we don't know how many of you there are here. We'll definitely feed you though. We also have opportunities to talk with you about your individualized class situations, or if you are feeling sick, we can give you guidance on how to get a hold of a medical provider. We don't provide medical advice in the Office of the Dean of Students, but we have that phone number for Cougar Health Services handy. We also can work with you to figure out what you need to do if you are thinking about leaving. So I want you to know that we work very closely with the Office of International Programs. They're one of our best teammates on campus, and so they're going to be the team that works with you on any questions you have related to visa concerns. So I know that there's some very specific things in the international student community that you want to have answered. I want to reiterate that we may not be able to give you the answer right in this moment, but we are going to take your questions and we're going to get back to you with the information that we can. So again, if you need help and you're not sure what to do or where to start, you're always welcome to contact us in the Office of the Dean of Students. You are also welcome to email your questions directly to the COVID-19 email address, which is covid-19.info@wsu.edu. And if you haven't spent any time yet on the COVID-19 website, I would encourage you to do that because there's a lot of really great information out there about decisions the university has made and decisions that we were thinking about. So you can find that at wsu.edu/COVID-19. So I think that's all I'm going to say for now, and I think turn back to Asif.
Thank you, teacher. Let me just say we're going to start questions and answers, but one question that has come to us repeatedly, and I'm going to request the provost to at least address that partially now and then maybe in detail if there are further questions about, we have spring break coming up and there's travel related to that, going for break, traveling to your homes or returning. What is the guidance? That's a question that a number of people have asked us, so I would request you if you could please address that.
So in terms of traveling away from Pullman for break, there are no restrictions. So you just heard Jill say that the dorms are open, the university housing's open. If you're living off campus, you do not have to leave Pullman if you don't want to, no matter where you live. If you do wish to leave Pullman, you may. If after break you want to come back, you can. There are no restrictions for leaving campus or coming back to campus around spring break. If you're going to travel internationally, you should consult with the international programs team about any travel restrictions you might anticipate. You don't want to find yourself traveling internationally and then find yourself quarantined for 14 days when you get back, so just work as you normally would with international programs if you're contemplating international travel. Many student spring break organized travel experiences internationally have been canceled. Again, mostly because there's a concern that things may change around the globe and then there might be travel restrictions that would make it difficult to get back. It's more that worry than it's worry about the disease. Some of those programs are working. So what the general advice we would give you, if you have family that you're consulting with, listen to your family about what they think the best thing to do is. If they would like you to leave, please leave, but consult. If you are sick yourself, you shouldn't travel. If you're sick after you leave, you shouldn't come back until you're not sick. Anytime you're sick with respiratory disease, especially with a fever, particularly if you have a known exposure, you should contact a healthcare provider and seek their guidance. But even if you remain in Pullman, if you're sick, you shouldn't come to campus. And consult a healthcare provider, call Cougar Health, call another physician in the community if you're more comfortable with that, and seek their advice before you come to campus. So whether we continue face-to-face classes in Pullman or across the system hasn't been decided yet. I've asked all faculty to prepare rapidly because I will predict that sooner or later we're going to, many universities you know have, those universities in the state of Washington that have, like the University of Washington or Everett Community College, they're on the quarter system. So this is their last week of class for that quarter. And then they have a 2-week break, and then they have to start again in spring quarter. They haven't made decisions about what happens on March 30th when they start up again. So they were in a slightly different place than we are being on semesters, but it's almost inevitable that we will go to online, some form of alternate or distance teaching where it's possible. Certain things are not possible. Like I used to be the dean of the veterinary school. We have 4th-year veterinary students doing clinical rotations. You can't do that online. So the other thing I want to emphasize is if we shift to more online or alternate methods of teaching, that does not mean we're closing campus. There's been a lot of inference, incorrect, that means we're closing campus. It's a means of social distancing, like having smaller group meetings or canceling larger meetings, moving more or most of our classes to alternate formats so they don't meet in a classroom is a way of social distancing. That's the whole purpose. The campus will still be open. Some things will require employees or students still to come to campus if it's safe for them to do so. If they're not immunocompromised or they don't have some underlying disease that puts them at higher risk, or if they're not sick, there will be opportunity to come to campus, and there may be at times you need to come to campus. So that, and I just want to emphasize that because there's so much misinterpretation of that right now in the preparation to teach online, is that we're getting ready to close the campus. We're not. That is a very severe decision that would be a long way off. And we have to socially distance. That's what this is about. And many employees may work from home more, but the campus will still be open. So just want to emphasize that. So there aren't travel restrictions. You should be thoughtful about your own health and the health of others if you're sick. You should consult your family, and you should consult international programs if you're contemplating international travel.
Thank you. So in that regard, let me mention one particular category of travel which might provide you some guidance. As you know, the Office of International Program manages the university study abroad programs. We send students from here to different countries. And there are students outside of the United States at all times. Based on the guidance from CDC, countries that have been designated at level 3 for the CDC travel guidance we have asked all students who are in those countries to return back to the United States. That means that there is, as far as we're concerned, our guidance is that we are restricting travel to those countries that are at level 3. And those countries, by the way, presently are Italy, China, South Korea, Iran. Is there any other? I think those are the ones. There are some countries that are level 2 or not designated. But the Office of International Program general guidance after consulting internally is that although we are not restricting travel to those countries, when students or faculty or staff are wanting to go to any of those countries which are not level 3, we are having individual conversations with faculty and students before they contemplate travel to those countries, and we are talking about non-level 3, to really encourage them to look at the pros and cons for traveling and what might happen in terms of possible restrictions about returning and possible need for quarantine. And as Dr. Slinker said, consider all those things, and then we want to make those decisions together with the faculty and with the students, and we're talking about official travel. Now, on personal travel, then of course that is the decision that everyone makes for themselves, but I wanted to share with you the guidance that we are using for official travel, if that would be any guidance for you to make your own individual personal decisions for travel during the break and beyond. So with that, I'm going to ask Cody from our Global Services section to moderate and tell us what the questions are so that our panelists can respond to them.
So, thank you. Just to make sure everyone can hear me. So Dr. Slinker, knowing that you have to leave at 4, I'm going to select some of the questions I think are a little more directed towards you. So the first one that I have on here that I think would go for you would be, let me find it. During spring break, undergraduates will travel around the west coast of the United States. After they come back, how could WSU protect instructors and TAs from potential exposure if we have a class or lab in person?
So this is why we're contemplating moving to online teaching. We manage this around known cases. Dr. DeVries can talk more about this, but I know everyone's anxious and I know everyone's concerned, but simple travel does not mean you've been exposed or you're going to expose others. So we ask people to be mindful. If they have a known exposure, they need to seek physician guidance, which might include not coming back. If they're sick, they should seek physician guidance and not come back. But if none of those apply, then we have no basis for prohibiting them from returning to campus, and that's where all the social distancing measures come into play. Reducing the size of events, canceling larger events, not assembling a classroom by going into alternative teaching methods. Once they're back, if they become sick, then the same thing applies. They should not come to campus, and work out with an instructor. If we haven't switched to online, work out with an instructor how to stay home and still keep up with coursework. If a faculty member is under self-isolation or becomes sick and can't come to campus, they need to work out with their supervisors working from home and keeping the students safe here by not coming to campus, but still perhaps teaching from home. So it's really about following the public health guidelines. But we cannot restrict movement in the way that would isolate everybody and totally protect them. But we're reducing the chances of such an account.
I think when it comes to preventing infectious diseases, very simple things are very powerful. For myself, as a physician, trained to know how to protect myself from sick people, I can tell you I almost never get sick at work. I've dealt with some pretty severely infected patients in the hospital setting and ICUs, I've never contracted any of that because I practice good hygiene at home. When my kids are sick or my spouse is sick, it's a different story. And so really it's those close contacts that we are most at risk from when we are in normal social settings. Some very simple things can protect us quite a lot. We now know within the last week that COVID-19 is not an airborne infection. It's droplet, and we think contact as well. So washing your hands, not touching your face, not being close to sick people, cleaning things, especially if a sick person has been there. These are incredibly powerful things. These are the things that all of our students on our health science campus are learning, in addition, of course, to things that we use when we're taking care of patients to make sure we don't get it on our clothes and give it to another patient or that sort of thing. But those things sound simple, they sound not powerful, but they're incredibly powerful. Those are the things we can all do.
So I just want to look back to the room to make sure if anyone is here in the room who would like to answer or ask a question, to just please put your hand in the air and I'll come up and bring the microphone to you. Dr. DeVries, to follow up on that comment, we had a question. Do we need to wear face masks?
So and it's DeVries, by the way, no worries, rhymes with trees. There aren't many of us in the state of Washington, but there's pretty consistent agreement from the Department of Health, the Centers for Disease Control, and the World Health Organization, so not just US-based agencies, that masks are for sick people. Because again, this is droplet precautions, and so if someone's coughing, we want to make sure they're not spreading droplets. We don't have any evidence that a healthy person wearing a mask in the community helps them. And I would suggest also that we need to be very cautious about how much personal protective equipment like masks gets used, because we need to have enough so that doctors and nurses and other healthcare providers can take care of people who are sick, and so that people who are sick can have one. And I recognize that there are other practices in other cultures, and people may have a variety of reasons why they may want to wear a mask. I'm just representing the medical science, and this again is where the Centers for Disease Control and the World Health Organization, what they are saying.
Thank you very much. We'll move to one question in the room.
Hello, my name is Tri. I'm represent for International Student Council. I have some, first, thank you for all the information you have. And I have some questions regardless of the Health and Wellness Center, and also the portal, the online portal for checkup after the spring break. So if after spring break, and I know that we have the flu season, that also going around too. So after the spring break, if we want to go check up for like a quick checkup from the Health and Wellness Center, do we have to go on the portal just like the rest? Like normally what we should do?
So any student on the Pullman campus with any kind of personal health question can call Cougar Health Services, and sometimes we can handle that over the phone, depending on the nature of the question, and many times we'll offer an appointment with a healthcare provider. There is also a portal by which you can make appointments. You don't have to call, you can use the portal. It's really important when you're using that portal to try to answer the questions on there as best as you can, so we give you the right appointment with the right healthcare provider. But yes, you can schedule appointments with us.
Yeah. And for some circumstance after the spring break, will the portal have the limited availability for, like, if let's say 1,000 of us want to go check in one day, if that ever happened?
You're asking about what our access is for appointments?
Yes.
So we see between 100 and 250 students a day. And we have lots of availability. Everything has a limit to it. But so far, we've done really well this year at seeing the people who need to be seen. And so I hope and expect we will continue to be able to do that.
Okay, thank you.
Okay, I'm going to move back to the first question that we received. Will WSU cancel the academic showcase on March 26th? I was trying to get you before you left, Dr. Slinker.
That is under discussion. We're not ready to announce it yet, but it's under serious discussion to cancel Showcase.
I have one more before you go, just again to respect your time. Let me find that question. Could you discuss a little bit more about the specifics that you're looking for when or if the university would switch to online classes?
That's a hard question to answer about the specifics of what would cause us to change. We're just assessing every day, basically. We don't have the disease here yet. We know there's going to be a lot of travel in and out over spring break. That increases our concern. The main discussion for us is, do we wait until a certain criteria, like we get our first case in Pullman, or do we just make a decision arbitrarily? And we're leaning toward the latter right now, but no final decision has been made about that.
And I'll sneak one in that kind of culminates a couple others. How would like a PE class, a yoga class, or another class that has an in-person component, like a required in-person component, how would one of those classes go to online?
With difficulty. There are certain things that you're just going to have to work with your instructor in the department to see if there's an alternative. So obviously, if you choose not to come back to Pullman, you can't be in with a group doing physical activity. But if you choose to stay away, perhaps you can work with that instructor to do those activities at home. So there's a lot of possible workarounds for these. And again, campus isn't closing, so it may be that those that are in Pullman still assemble for that. Maybe they keep further distance from each other, or they break up into smaller groups to keep the group size down. Or maybe everybody does it individually in their apartment, and they don't do it as a group. So some of those things are just going to require discussions individually. 90% of what we do will be straightforward, but it's that 10% that will be difficult. We'll have to rely on you and your instructors and the leadership to be really creative about how we keep student progress, but keep everybody safe.
Thank you.
Okay. I will look back to the room to see. We do have another question in the room that I'll move to.
So a couple questions about housing and residence life, as well as dining options during spring break. For spring break, do you know when the hours of operations will be announced, specifically for our international students who definitely know they will be on campus? Because I see that online it's still reflecting the hours that we were anticipating. And then the second part of the question, in a less than ideal situation, should students possibly be in quarantine or isolation and have a roommate on campus who are not able to return home, more specifically if it were an international student with a roommate, what will happen at that point?
All right, so you have two distinct questions. So I'm going to break them down. The first question about dining, just keep an eye on the website and we'll update that information as soon as we have it available. As far as, can you say that second question one more time?
So the CDC right now is recommending self-isolation if you think that you have the coronavirus or if you are diagnosed with the coronavirus. And they are saying that you should have someone bring you goods or the needs that you will need for those 14 days. So if that student who is in isolation is a 18-year-old international student with a roommate or possibly two roommates in our Stevenson complex, what will happen in that situation, especially if those numbers continue to increase?
The first thing that we're going to do is follow guidance from a physician, and so that will be kind of part one there. And then after that, we do have a plan in place that we do have some bed space available for students who need to self-isolate potentially away from their residence hall. So that is an option at this point in time.
Okay, let me get back to my notes with the list. So the next question that we have is traveling inside the US safe, especially if my flight goes through Seattle?
Who wants to take that?
I think it's just important that you monitor the guidance from the World Health Organization and from the CDC about what travel advisories are. We can't make personal travel decisions for you if you're going away for spring break, or if you're traveling within the United States, or even if you're traveling internationally over break. That decision, as VP Chaudhry mentioned earlier, is really a personal one. And so what we would encourage you to do is take the best information that you have available for you before you make that decision. But university travel is restricted to those level 3 and level 2 countries.
Thank you.
Hello, I'm Chris, international student from China. I have 3 questions. The first question is about the libraries. We know that the libraries is a public indoor house that the coronavirus may spread quickly, but on another hand, the library is very important to me, and if the library closed, I make an F in my class. So, what will the actions take by WSU libraries, and if the library has to be closed, will we have the options to check out books and laptops?
Yeah, I think that we will take that question to get the specific answer, but I do know I had a conversation with our Vice President who's in charge of information IT, our Chief Technology Officer. I know he is looking into the possibility of finding loaner laptops or access to technology if we get to a point where we are not able to go to the libraries or go to classes, and we encourage students to do their homework and their classes online. Then he's working on a possible plan to provide access to that technology. At least that part I know, but the rest of it, we will get the answer for the first part and get back to you.
Does the library now have any action to keep the library rooms clean and safe like this?
I think that goes without saying that everyone is trying to do that.
Yes, in fact, our custodial staff has received training in cleaning areas, and they have certain areas that they're making a priority to clean, surfaces specifically. And so those areas are being looked at with the idea that they do need to be cleaned, and the staff need to be trained how to clean them the best way.
The second question, does WSU has any plan to support the local poor man community? Because some citizens, they rely on the WSU service, and they may not have enough information as we do in the campus, and the elementary children, their parents, or local people may, I don't know if they are worried, occasional, or panic. And so do we have some plan to our faculty or student to do some volunteering or offer more help to them? We don't want anyone in poor man community to get sick because it's so close to the campus.
I can't really comment on volunteer opportunities, but I can say it's very difficult to separate the Pullman campus and the Pullman community, because many of those families, those children in the schools you're talking about, those are our kids, those are our families, and so it's very hard to separate them. I can tell you there are lots of conversations going on within the community. Today, for example, I was at a Whitman County meeting about COVID-19, and there were people there from the public schools, from all the hospitals, from various emergency services. And so there's a lot of collaboration, a lot of information sharing. It's a great team of local people really working together.
Final, I have a personal request to if the WSU can offer more information in different language for international students, because many international students, especially as our Chinese, they are shy to speak up, communicate, and I know some Chinese, they have the misunderstanding about not panic is equal to not occasionals like this, and I know a Chinese teacher who was giving me a lot of information before I go to WSU. She's now in China and not able to come to the WSU, but he always asked me to forward some email from the president's office to her so he can translate more information in Chinese to help the Chinese students. And I know there was some fake news in China.
Cody, you want to address that?
I'm listening on 2 earpieces, so I'm delayed. So right now, WSU is working on getting some translations of information out there. So one of the things that we have is we do have some volunteer translations that are going out. And so I would like to, just down at the front, you can see the International Student Council President, Ximeng Li, is doing a lot of translations for our Chinese community. We're also gathering other resources that are available to publish them out. You can reference, again, for international students on International Programs website, we have a bunch of the FAQs. So you will be able to find that on our website as well as on the COVID-19 website that the university has put together. In terms of other questions you have that may not be there, if you want to direct those to my office, particularly anything for international students, what we can do is try and get better access to those materials in other languages also.
I can also share that at Cougar Health, we do have a medical interpretation service, so we are able to get a large number of languages where there are trained medical interpreters that provide confidential interpretation. And in fact, for a number of those languages, we actually have the interpreter on a little tablet on this little cart, and it's like there's this third person sitting right there in the room. And so students who have questions about health information or their own health, they can call us and they can come to us and we can have those conversations in your language.
So we've come up with this question a lot out of my office. I'm sure it's in other offices. So I'm going to ask it. We know the answer and we've addressed it already, but I want to just answer the question and get the very simple answer. Is there anyone suffering from COVID-19 in Pullman?
There are no reported cases of COVID-19 in Whitman County.
Thank you very much.
Yes, including Pullman.
This one I'm going to direct to CRCI, if you would be so nice. So if students report racial harassment, will the person be punished?
It's a good question. It depends on the situation. So when we're looking at discriminatory harassment in the United States, there's a balance between what is something that we can prohibit versus what is something that is considered protected speech under our First Amendment rights to have freedom of expression and freedom of speech. So when we receive reports, we're looking at where it falls on that spectrum of discrimination, right? That doesn't mean that a single comment is okay, though. Our university prohibits discrimination. What it means is our response is slightly different depending on where it falls on that spectrum. So if we receive a complaint of something that happens, maybe it's one comment or something that maybe doesn't quite rise to the level of a violation of university standards of conduct for students or employment policies. It doesn't mean that we still can't take steps to address it. It means that somebody might not have a formal sanction through the conduct process. Now, there's a lot of conduct out there that could result in formal sanctions, and so that's why we want to make sure people are sharing information with us. It's also important for us to identify if there's patterns of behavior. So you may experience something that you don't think is sufficient to report to our office. We would ask you to still report it because it helps us understand if multiple people are experiencing the same thing, we're going to say it's rising to that pattern of behavior and it might be something that we can address. And it's also possible that you might experience something that somebody else experiences from the same person, that somebody else experiences from the same person, and now we have enough conduct to hold somebody accountable for a sanction too. So I would just encourage you to share with us any information you have, and we're happy to work you through what it might look like as a university response.
The next question that we have, if students are planning to go back now or over summer, would those students be able to come back in the fall?
I don't see any reason that students can't return in the fall, even if they leave for the summer. Just to reiterate, the campus won't be closed. If there are alternative modes of instruction in place, that's a decision. Those are decisions that are made by students and their instructors and how they finish their coursework. But we will be here. We'll be open.
Yeah, so let me just second that as well. That from international programs perspective, we are providing the guidance that we are discussing here, but the rest of it in terms of travel to Pullman, unless there is a declared reason for why you cannot go to a particular region, and that means coming back to Pullman, there shouldn't be any restriction, but use, as previously discussed, good common sense, how you're feeling and whether that travel is necessary, important, and how that travel might affect the possible spread of any medical issues that you might be facing. So other than that, we should be open.
The next question would be, if the university does move classes online, will that affect the ability to graduate?
If the university moves classes to online, that should not have any impact on the ability to graduate. The purpose of moving to online is simply to provide safe environment, not to affect the ability to complete the requirements and graduate.
The next question we have, does Pullman have the coronavirus testing kits available?
Yes, this is information that's changing all the time. A week or so ago, there was not a single test that could be run in the state of Washington. And then the state lab opened and could run 100 tests a day. Now we have 2 other labs besides the state lab that can run tests, but we do not have as many testing kits as there are capacity at the lab to run the kits, but we do have them. We have them at Cougar Health. I know Pullman Regional Hospital has them. They are not of high enough number that we could test everyone with respiratory symptoms. We need to save them for people who are most at risk from COVID-19, people whose health and life would be severely impacted. So we don't have enough to just test everybody who wants it, but we have enough to test the people that we need to test right now. And those recommendations about who gets tested are changing constantly based upon what's available. If tomorrow I have 20,000 test kits at Cougar Health, I would be happy to, over several weeks, schedule 20,000 students to be tested. But we right now have a small number in Pullman.
Thank you. The next question we have, do the students' opinion matter at this point in order to change to online classes? So I guess what the question is trying to ask is, if students are asking their professors to change to change online, is there support from the university if a majority of students wanted to do that?
Would you like to address that?
Try. In working with, my normal job is not to work with a group of vice presidents and chancellors in a room trying to develop policy. But as I've been doing that, what I have noticed is that they're very, very careful to consider everything they can think of before they start just making policies and making changes. And this decision about teaching modes has been a difficult one for them. I've watched the process and watched how difficult it is for them to make that decision and all of the elements of that decision that they're bringing into the discussion. So what I can say is, while I can't tell you that there's been a student vote and then there's total student support for that or faculty vote or anything like that, I can say that all of those kinds of things have been considered by people who have responsibility for trying to speak for students, for trying to speak for faculty, and trying to speak for staff. All of those people have been in the room as these things have been discussed. And so there's a great deal of perspective on those decisions. And that's what I can tell you about that.
Thank you. I want to look around the room and see if there's more questions.
So I noticed that some friends of mine and also some other students, American and international, still display acts of racism and also underestimate the harassment that are happening despite the blasted email regarding, for the lack of better words, international students being harassed or bullied. So should the trend continues, what will be the next step that you may or may not have planned to do?
So one thing that's really important is for us to get those reports. Just based on our experience and knowledge about how racism and xenophobia manifest in the United States, I don't believe we're receiving the number of reports of the experiences that our community's actually having. It's very helpful for us to have that so we can make those calls and decide what to do. For folks that are afraid to report and are more comfortable reporting anonymously, what I would ask is that you put as much information into the complaint as possible. So noting that something happened in a class, it might be difficult for my office to investigate that, but if you put it happened in this class, at this time of day, in this elevator, with these people, and this is what they look like, even if I don't know their names. This person had blonde hair and this person was wearing a backpack. All of those details help us, because maybe if we get a report about harassment and you don't know who the people are, there might be video cameras in the area. We might be able to identify who those people are. And again, if you're ever experiencing anything on the level of a crime, I would just encourage you to call the police right away, because they can get there really quickly, right? And so, especially here on campus, our WSU police officers can show up very fast, and that might help us capture the folks that are actually engaging in those behaviors.
Just to follow up on that, I think we traditionally in law enforcement believe that we receive about 10%, reports of about 10% of the crimes that actually are occurring in our country. 10%. So just another plea that please report. It really helps us. Even if we don't find who did it, we learn, and we can put that information to work. So please report. I think that's what we're both trying to say.
Maybe a good example, a couple of years ago, there was some vandalism that was occurring that was targeting a specific group on campus. And we didn't know who was doing it, but it was impacting the community. WSU Police Department put plainclothes officers into the building to try and monitor what was happening and try and catch the person. Those are steps that we can take if we know about that happening in a specific area. So that's why it's helpful for us to have that information.
I think we had a follow-up to that question.
I think there are two reasons that why students are not reporting these much as possible as they can. The first one is that they doesn't understand what is sarcasm, because students are saying it in a really deep way, which the second language students won't understand. And then the second one is they don't know what will happen to them after they report it. I just wanted to ask what will happen to that person if they really report it.
Yeah, that's a really good question. So the question is, what happens if you make a report? What happens to you as the reporter? So a couple of things. Let's start with an anonymous report. If somebody reports to our office anonymously, obviously we can't reach back out to you. We capture the information though you provide, we document it in our database because we're keeping track of all the incidents that are happening, and we engage in outreach if there's information that we can engage in outreach on, or we engage in investigation if there's information that we can engage in investigation on. If you call and share your name and report conduct that happened to you specifically, let's say you experience something that something that's sanctionable under the university's policy, and you come to our office, you meet with one of our investigators. We're going to do the same thing. We're documenting that information in our investigative files, we're documenting our database, and then we're going to ask you what your preferred outcome is. Because your interest in what's going to happen is really important to us. So we've had some students, in a wide variety of cases, some students will come to us and say, I want you to talk to this other person and explain to them why what they're doing is wrong. We can do that. Some folks come to us and say, that person hurt me and I want to see them sanctioned under university policy. And it fits our policy and we can proceed with a formal investigation. Now, I want folks to know that that process, it is sort of a formal process when we're investigating. So we do send notice to the person accused of misconduct. They also have rights to provide information to our office. But then our investigator is the one gathering the information, interviewing witnesses, any documentary evidence that might exist, and they're going to write a report of their findings. And that report goes to the person who made the complaint and the person who is responding to the complaint. We also send it, in the case of students who are engaging in misconduct, to the Center for Community Standards, where it could go through a conduct officer or conduct board proceeding that could result in educational sanctions, including expulsion or suspension. For employees, if an employee is mistreating somebody, we would send our report to their supervisor, who could decide what type of employment actions would be appropriate.
I'll just add to that. So the Center for Community Standards that Holly just mentioned is also one of the areas that I work with directly. And those, the office there and Holly's office are in very strong partnership and communication in the way that those things are resolved. So I just want to reiterate, we do want to hear what it is that you would like to have happen as a result of your report. We can't promise that's what will actually happen as a result, but it's really critical for us to understand what will help resolve the situation. We want you to have an opportunity to learn at WSU in a way that you feel like you can be in the community safely. It's really a critical component.
So I just want to say, you said something that concerned me, and that is that sometimes people say things and it's hard to understand the context, or it's hard to understand what's sarcasm and what's I'm going to use the word playful, but some of that's still mean. Some of that is really still mean. And it comes out of an ignorance in a lot of cases. And we are not immune to ignorance anywhere, kind of on the planet, right? And so I kind of hope that I would love to see a situation where, or a culture where people could feel comfortable reporting something, if only just to talk about those things, and if only just to feel a little bit better about, okay, I've made a report. I feel like people around me understand this better, and that goes back to my very first point. There are more people who understand and care about you as international students then there are people who are ignorant and are trying to hurt your feelings. And so maybe in that process of reporting and talking to people and finding a listening ear, there's some healing there, I kind of hope. And so I just encourage, there's so many reasons that reporting is a good idea that I really hope that that can be communicated, and you can feel that there's some concern there on our part, that you at least talk to us about it. And many times I know there's just not very much we can do, but at least we can talk and connect human to human.
Thank you for that. The next question we have is, wouldn't it be too late if we switch to online classes after there's one case on campus? Why not prevent it from happening beforehand?
Well, I wish I knew the exact answer to that. I'm not an epidemiologist. Is that the right word? Okay. But I think the last thing I heard Provost Slinker say was that the decision, that's part of the decision matrix, is do we wait, do we not wait, do we, and I think the last thing I heard him say was we probably would not wait for that. But I'm not making a promise that. I'm just saying that I think that that's part of the decision matrix, and that's what I heard him say as he left, is that there's some resolve to be a little earlier.
Hi, everyone. So my question is, so all we know that Moscow in Idaho is also pretty much close to our campus, and they have also University of Idaho. So, and most of our students, usually they go to do shopping there. So do you have any joint committees with them as well, like about coronavirus, all these things?
We have an organization that is Latah County and Whitman County wide. Latah County is the county that Moscow and University of Idaho is in. And we meet monthly. It's called the LEPC meeting, and I wish I could remember the acronym. LEPC meeting. Anyway, it involves both the emergency management from both counties, and they're meeting and contacting each other to coordinate. Provost Slinker described the emergency management system that is in place for the entire state that kind of overlays these different government agencies. The purpose for that, and it's a federal system, the purpose for that system is to give us an opportunity when there is an emergency that runs between different jurisdictions, between different states, to provide ourselves with an operating stance that is consistent from state to state, from region to region, to city, and part of that system, or the part of that LEPC meeting, that LEPC meeting between the counties, relies on that kind of coordination. And so there is that coordination between the counties. Is it strong right now? Not as strong as I think we need to push it to be, but it exists and it is operating right now around this problem.
The next question I have, if classes do go online, many students access WSU computers with programs such as Avid, Adobe, SQL, etc. Programs that they can't afford themselves or that they can't use on their computer because they have a Mac instead of a PC. Can you address what some of the options are for those students to get access to those materials that they may need for their classes?
I think it's a really important question. It's one that we're aware of and not able to answer today, but we are definitely thinking about that question, and we'll be able to get back with an answer shortly, hopefully.
How can you communicate with someone if he or she thinks COVID-19 is no different than the flu and keeps talking to them about using masks and how they're overreacting? How can you explain the difference between the flu and COVID-19 to someone?
That is a difficult question to answer because we don't entirely know. We know some differences. We know that among those around the world who've already been infected, it seems to have more people having severe disease, up to about 15%. We know that it impacts small children much less. We don't quite know what that means for us, though, because usually it's our runny-nosed small children that are our vectors for illness. So how that impacts us is hard to say. I think it's the fact that we don't know enough yet about COVID-19 that makes it so significant, certainly from the healthcare sector's point of view. Whenever there's a new infection, our first goal is to contain it, to just prevent the spread, because we don't know how bad it is. And to some extent, we're still doing that in this area because we don't have it. But largely across the world, we're moving towards mitigation. We're moving towards lessening the impact, spreading that impact out so that our healthcare resources don't get depleted, so that we know more about it by the time we see more people get sick. So I think it's really the unknown aspects of COVID-19 that make it different from the flu. At some point, when we understand it better, when there's more immunity in the population, when we have the capacity to immunize, at some point we may think of it like the flu. We don't know yet if it's going to have a seasonal pattern. We don't know yet if it's going to die down over the summer and come back next year like the flu. But there may be a point where we say, yeah, this is like another flu, but right now we just don't know.
To continue in that same vein of questions, is WSU Health and Wellness stocked with the COVID-19 test?
So I answered that question already. We do have some test kits, yes.
And then continuing, how does Pullman Healthcare facilities such as hospitals and doctors and clinics preparing for a potential outbreak of COVID-19 in the Pullman community?
So I can't answer in a detailed fashion about our hospitals. I know that I partner a lot with the emergency department at Pullman, and they're doing a lot of the same things that we are doing. I know that we are all just following current recommendations and staying informed and being ready for what we think may or may not happen. As we've learned more about this infection, fewer people are being hospitalized. Most patients we expect are going to be able to stay home and what we call self-isolate at home. They don't need to be in some special hospital room. And so we're just, again, being flexible and informed and prepared for what we think is coming.
And the last one that I have for you in that same vein, it's been reported in the news that the COVID-19 test cost is $3,000. How could, sorry, I just lost my connection.